Hi, my name is Carissa, and my topic is how type 2 diabetes affect African American adults. So, in my topic, this is type 2 diabetes is the sixth leading cause of death in the United States. In 1991, type 2 diabetes increased by 61%. In addition, in 2007, approximately 90 to 95% of African Americans were diagnosed with type 2 diabetes. Type 2 diabetes is a national epidemic and a critical public health concern. A little background knowledge about type 2 diabetes. Type 2 diabetes is a chronic condition that affects an individual body metabolize sugar. Type 2 diabetes causes a decrease in pancreas beta cells functions, which alters the increase. It is also known that type 2 diabetes is an insulin resistant, and many studies have shown insulin resistance is influenced by genetics that causes type 2 diabetes, and it's been well established as a genetically transmitted condition for both age on onset and prevalence. Type 2 diabetes is insulin resistant. Health disparities that occurs in adult African Americans with type 2 diabetes. Unemployment. When doing research, I saw that it was unemployment or they didn't have much income. Education-wise, well, stating from my research, it does not always mean because they didn't finish high school or they didn't have a degree. This also went for not being educated about the medical terminology of type 2 diabetes. They didn't understand the writing when the doctor prescribed the medications, or when they were talking, they didn't understand. So when they went home, they went back to eating unhealthy instead of having a diet, and their diabetes was out of whack instead of having the time to manage their type 2 diabetes. And obesity is another factor because they're eating and not watching what they're eating. No to very little physical activity. This I found was more in women than men. When doing research, women said due to families it was so complex even balancing to do any type of physical activity. Also, they didn't have gyms that were close by and no sidewalks to walk on. And some women who lived in the areas that wasn't so great to live in, they didn't feel safe walking the neighborhood due to it was unsafe, so they didn't go out and walk and do a physical activity. So that was a hinder as well. And overall, the low socioeconomic status, SES status. Gaps in the literature. I feel there should be interventions in every state, not these certain states. I feel in every state and city they should have interventions. I also feel they should have sidewalks and bicycle lanes, so that's two different physical activity. If you don't have a bike, well, then you can walk. Potential solutions. Well, like I said, having interventions every state. But when I was doing my research, there was an intervention for me called Racial and Ethnic Approaches to Community Health Workers, and it also go by REACH. And what that is it aims at reducing disparities in diabetes and health-related conditions among African American men. It is an empowerment-based approach where they provide health community workers to help with their diabetes and self-management and educate them. And they go on regular home visits to them, and they go to the doctor's appointments as well. So another intervention that I thought was really great was diabetes self-management education and diabetes self-management support. Okay, so diabetes self-management education is a process facilitating the knowledge, skills, and ability necessary for diabetes self-care. And the diabetes self-managed support, which refers to the support that requires for implementing and sustaining coping skills and behaviors needed to self-management on an ongoing basis. So when they leave, they still have these skills to cope. And these programs were designed to address the patient's health belief, culture needs, current knowledge, physical limitations, emotional concerns, family support, financial status, medical history, and health literacy, and other factors that influence a person's ability to meet the challenges of self-management. So another benefit I felt was it reduces that going to the hospital and readmissions and lowers the complication risk. So by having this ongoing support, education, and support of diabetes, it helped them overcome barriers and to cope with ongoing demands. And it benefit them because it helped people with type 2 diabetes to learn and apply knowledge, skills, and behavior and problem-solving coping strategies required to balance many factors in their life. So I thought that was a really good intervention. Now, another intervention that I'm going to talk about is called Get Your Goal. And a Get Your Goal is was from Memphis, Tennessee, and it encourages African Americans and type 2 diabetes to know the average blood sugar level. And over the past 2 to 3 months, and speak with their physician about setting obtainable personal goals, I feel that sometimes people with type 2 diabetes are not sure how to even attain their goals because they're not sure if they have high blood sugar or low blood sugar in research. So, by knowing if they have high and low blood sugar levels and talk to the physician, it'll help them set goals that are right for them, and they develop a personalized diabetic management plan, which includes diet, exercise, and medication to help achieve individual goals. So I thought that was I really thought that was a good intervention, and also having family members involved in family-focused interventions, so problem-solving of behaviors which may improve the context in the patient's perform daily self-care, enhance their ability. So having family support increases the ability of the person, how they feel about when they have type 2 diabetes. So it's very encouraged to have family at these interventions as well. Also, another thing that I thought was having community health workers. And what community health workers is a promise to improve health behaviors and outcomes, particularly for African American adult communities and those who traditionally lack access to adequate care. Now, and it lists and train community workers who work as bridges between their ethnic, culture, and geographic communities and healthcare providers to promote health. So what they do, they educate the patients, identify resources, provide case management, coordinate care and partnerships with healthcare systems, and become a part of an individual support network. Again, this is an empowerment-based approach, and it has been very effective with African American adults with type 2 diabetes. And it improves diabetes knowledge, diabetes self-management behavior, and diabetes-related distresses. Okay, so like the community health workers there in the training includes the diabetes education classes, 2 home visits that last about 60 minutes each month for the self-management goals, one clinic visit with the patient and their own physician. And they also have call them. So they have 11 to 2-hour group sessions with 8 to 10 individuals, which were held every 2 weeks at the community locations. And they discuss in these classes the development, implements, and evaluation of the class. The home visits and family health advocates came out to the homes too for the patient, assist them in the settings and patients and if goals and supporting their progress. So I just feel that these type of interventions will be great potential solutions. And this is the end of my video. Thank you for watching.